Good afternoon, everyone. The topic of my paper is endogenous endophthalmitis in ICU patients at a tertiary care center in Western UP. Endogenous endophthalmitis is a rare but vision-threatening intraocular infection caused by hematogenous spread of pathogens from a distant systemic foci. This condition possesses a significant diagnostic and therapeutic challenge, particularly in critically ill patients admitted to ICU, where multiple risk factors such as immunosuppressions, prolonged hospitalization, invasive procedures, and indwelling catheters are prevalent. In India, especially in a tertiary care center in regions like Western Uttar Pradesh, the true incidence and clinical characteristics of endogenous endophthalmitis among ICU patients remains always underreported. So the purpose of our study was to determine the incidence, predisposing factors, comorbidities, spectrum of causative organism, and outcome of endophthalmitis patients who are admitted in an ICU of multiple departments. It was a prospective observational study conducted over a period of 1 year from January 24 to December 24 at a tertiary care center in Western Uttar Pradesh. Patients who were included in the study were the patients who were admitted because of their critical illness in ICUs of multiple departments like medicine, obs gynae, general surgery, and orthopedics, with the clinical suspicion or diagnosis of endogenous endophthalmitis. All of the patients were having an age of more than 18 years. Patients who were not included were patients who were suspected of having any of the exogenous cause because of any history of ocular surgery or a trauma or preceding injections. And also the pediatric patients less than 18 years of age were also not included because of the other risk factors. And patients who were having an incomplete clinical records or refusal for ophthalmic evaluation because of the critical illness were also not included. The data recorded were about the demographic information, primary diagnosis for admission, presenting ocular symptoms and signs, blood and intraocular fluid culture results, lab investigations, general lab investigations, the treatment given, systemic and intravitreal injections both, and visual and systemic outcomes. During this 1 year period, we were reported about 31 cases of endogenous endophthalmitis among 12,500 annual ICU admission, resulting in an incidence of 24.8 cases per 10,000 admission, corresponding to an incidence of 0.248%. 29 patients were having monocular involvement, but unfortunately 2 of them developed the other eye involvement later. Maximum number of patients were having a TLC count of more than 15,000, followed by 10 to 15,000. The maximum number of patients were having an associated illness being diabetes mellitus, followed by the HCV infection-induced chronic liver diseases, which is very prevalent in this Western UP belt, followed by the patients with CKD. Few patients were having malignancy and they were on chemotherapy. 2 patients were having immunosuppression, were immunosuppressed because of HIV infection, and 3, there was no any associated long-term associated illness. When the vitreous and aqueous culture was done for microorganisms, the 30 maximum number of patients were having a MRSA, methicillin-resistant Staph aureus, as a positive, followed by the Streptococcus bacteria. 4 patients, all of them were diabetic, were having Klebsiella as a positive bacteria. 3 patients were having a mixed growth of both positive and negative bacteria. 2 patients were positive for Aspergillus, and 1 of them showed Candida species. When the ICU duration was assessed, maximum number of patients were having an ICU duration of more than 21 days, followed by 15 to 21 days. Means maximum number of patients were having an ICU duration of more than approximately 2 weeks. Patients were having an ocular manifestation, maximum number of patients were having a decreased vision, and because this is the reason they were asked for reference by their respective departments. Many patients developed lid swelling, conjunctival congestion, corneal haze, and because of corneal abscess. 19 patients were having hypopyon, and followed by purulent ocular discharge and chemosis. They were managed according to EVS study. We performed vitrectomy on patients with vision only, perception of light or less. They were 25 patients, and they were given along with intravitreal antibiotics. We performed the vitrectomy on these patients, and majority of them were diabetic. Intravitreal antibiotic injections of vancomycin and amikacin combination were given in 28 patients, and 3 patients who were positive for fungus, they were given an intravitreal voriconazole injection. And since it was an endogenous cause, all of them were receiving already intravenous systemic antibiotics. After the first intervention, we assessed the visual acuity after 60 hours, and It was assessed that 3 patients were improved from more than hand movement. So this study underscores the critical importance of early recognition and targeted management of this endophthalmitis in ICU settings, a rare but sight and life-threatening condition that is often overlooked amid critical illness. So this is to initiate that ICU admitted patients should have a mandatory ophthalmic reference every week for early evaluation of any eye involvement, which is usually ignored amid critical illnesses. Thank you.
In the patients you have done vitreous, you have sent the sample for microbiology, vitreous sample.
Vitreous samples.
And was there any agreement between that and the blood culture if was done in the ICU?
Yes, ma'am. Those patients who were positive for blood culture, like for fungus, candida, and Klebsiella in patients में positive था, patients में vitreous samples में भी Klebsiella मिला है. Especially, so there was a strong correlation between the blood culture reports and the aqueous and vitreous culture reports. So this indicates that the infection may come is probably from the primary foci, which is somewhere else in the body. So many of the patients were having a pneumonia and chronic liver abscess as an associated illness. So it was very difficult for those critical patients who were admitted in ICU to make them shift to in IOT and convincing other departments. So it was very difficult, but it was just to create awareness among other department also that they should send the reference for ophthalmology if the patient is admitted in ICU, so that in case the patient recovers, those vision deteriorate now in future life.
So what % of cases had like systemic same organism or sepsis associated with who developed endogenous endophthalmitis? All patients were having sepsis or
Ma'am, all of them patients were having bacteremia or
some kind of sepsis was there, and similar organism from like other sites and ocular sample.
Ma'am, maximum number of patients were having similar organisms.
You
same
did not
class,
calculate
gram-positive bacteria. Maximum number of patients gram-positive bacteria.
So they must already be getting antibiotics.
IV antibiotics they were receiving.
This you should mention the percentage. Like
yes.
What was the percentage of patients who were actually getting similar in bodies, any other side sample and in ocular sample.
Yes,
and whether you changed antibiotics for that or not.
When we performed the we gave the intravitreal antibiotics according to the guidelines.
That was for ocular sample, but
ocular.
Systemic also they must
systemic
be
they were already receiving antibiotics.
And all were ICU cases.
All of them were ICU patients.